The worst, I think, scenario in the last few years has been COVID. Why pulmonology?
Yeah.
I think you were the most sought after doctor during that period. Anything and everything about the lungs is known to you. Knowing how to breathe, being aware of your respiratory tract health. And if what is rumors are to be heard about China producing another virus similar to COVID, fresh green air would be very healthy for the lungs. What if I were to tell you that any of your problems with the lung can be diagnosed under one roof and treated in the same place without being hospitalized? Hello, everyone. Welcome to V3Podcasts. The worst, I think, scenario in the last few years has been COVID. And COVID has been a horrible situation for many of us. There have been many losses in many families. There have been horrible situations when people were in isolation. And this could have been avoided simply by being aware of your respiratory tract health, knowing how to breathe, knowing how to keep your breathing normal. And today with us, we have a doctor, Dr. Varun Patel. He's a pulmonologist. If what is rumors are to be heard about China producing another virus similar to COVID to attack the world, then knowing about him and knowing what he can offer us is, I think, the need of the hour. So please welcome everyone to Dr. Varun Patel. Hello, sir.
Hi.
Welcome to
Namaskar.
VQ Podcast. Anything and everything about the lungs is known to you.
Definitely.
Okay, so what was your inspiration behind going into? I mean, many people when they pass their MBBS, they want to become surgeons or they want to become, practice medicine. Why pulmonology? What was your inspiration behind it?
I had a passion, so I cleared a JE and I obtained admission in a SAPT.
Okay.
And then I want to be an architect and a town planner. Papa's friend told me if you are getting a doctor, why you want to become a civil engineer? That's how story was started. So the conclusion was there that any one member should be a family. In a family should be a doctor so can guide us. That's how next day my admission was there and I got in medical.
You got
school.
into medicine.
Right.
But why
I
pulmonology?
think I got a diploma in tuberculosis.
Okay.
Right. I used to operate a hernia. I used to operate a circumcision, hydrocele. Even in a gynectomy, I used a tubal ligation, like 15, 16 of the breech delivery. I had done normal delivery. And then I can say when I was in a surgery, then if the other fellow come for a scrub, then I go to the anesthesia part and do the general anesthesia as well. So that 6 months, which I the shaping my life is from the Rajkot Medical College, Government
Basically
Medical
got
College.
a taste of surgery.
Surgery, both
And at the same time, you were doing tuberculosis. So then it went without saying that pulmonology and becoming a surgeon there would be the next step.
Yeah. So then after that, I coming the diploma, I came to outside. I went to the Kailas Cancer Center. You know, very good cancer center, the Goraj, run by Muni Ashram. So when I there, they apply for the job because my senior was there doing pulmonology, and after that he's doing a job and managing all the ICU. He says your salary will be X, not X plus Y, which was getting the previous candidate. Then I say why? So because you have a diploma.
And not
So
a
I
degree.
thought
Okay.
I has to go for the degree, and then my all India Brahman Yatra was started. So I go the good, like when I heard about the good college who had a deep this DNB course, I go there apply for the interview. So I got in a Roorkela, right? I got in Medicity there in Hyderabad. I got Mahavir College in Bangalore, but I choose the Amrita Institute of Medical Science, right? There was
Why? Because it was reputed for pulmonology?
not like that, but when I saw that institute through a train, right? And my senior was there, then his emphasized me. So anyway, maybe some attachment or some attraction was there which pulled me. But story behind that, in 2002, when I was there in MBBS, with the family, we go for the Kerala trip, right? And South Indian trip. And that was a mind thoughtscape. If I live here, it's very good place to
peaceful and beautiful.
There. So somehow that drove me, and then after 3 years I passed in a Kerala. And actually that surgery which I did in an internship, which shaped me to such a level, right? There in Amrita, because I started first thoracoscopy, pleuroscopy there. I taught my the seniors and my professors. So my professor are so confident in me, they just say this procedure has to be done, this bronchoscopy has to be done. They simply, like though I was a student, they blindly believe me and give it to me.
But during the period of COVID, basically, uh, what was your experience with patients? I mean, how were you able to help people? I think you were the most sought after doctor during that period.
Right. So the COVID story, it started in March month. In February end to the March month, it's outbreak in the society. So
Okay.
I was working in Chase group known as Ashray Associate. We are 6 pulmonaries together. So that in a COVID, like the people got admitted, everybody's scared. So all the burden is come to the student who are doing the PGs. So they are first year, second year, third year PGs who just passed out the MBBS and complete the internship. So they have a knowledge of the subject at certain extent, but not of the clinical knowledge. So at that time, Dr. S.K. Malkhan Sahib, who was the superintendent of SVP hospital, they called Dr. Atul Patel, ID specialist, and then he shared his view about some people who come from the private setup to come there. He chose me, like as a youngster, and senior doctors are sitting in a department. They go through the data, they discuss, and by phone call, they're managing on that. So Dr. Atul has to sit with that group, and I has to go at the patient side. So wearing all the PPT and all this thing, right?
I have worn that, and I know it is
Right.
horrible.
So the thing was there when I choose that, right? I have to took a permission, like for my family, because my grandmother was she was at about 85 that time. My father was 65. My mother was 60. My sweet life partner was pregnant.
Okay.
Right, and she's about to deliver in July. My sweet
I think
daughter.
the lockdown happened in March, somewhere
Yes,
in March.
23rd March. And so I took a permission. I say, look, I studied in government hospital where fees is just about 300 rupees per 6 months somewhere. So this is an opportunity which I have to give back to my society.
What I have got.
Right, what I have got from the society, because when I studied there in medical college, my fee is 300 rupees.
So COVID actually got a lot of unsung heroes at that time.
Most of, like when I took permission from my wife, the case, okay, you can go ahead, I don't have a problem. Father, mother, they are okay with me. My grandmother was
So
a
you
little bit.
actually went into the war of COVID.
So I was the first person, and when I go there, when I come back, so my colleague, my friend, they making a distance from me. You went to the hospital, you should understand this.
You must be COVID positive.
Yeah, you take like spread the infection to us and all this kind of. I have to heard all the kind of the allegation and that. So look into that. Somebody has to step in.
But the lung diseases after COVID got over, when the pandemic as such stopped, did the cases of pulmonary fibrosis and all, were they very high?
So
did you have a lot of work?
I remember one patient. She is a Durga Ben. Like after working in a COVID, like I told you the story of the SVP, then private sector was started. I started with the work in SGP. I was the person.
was still not started.
No, Swasan was started in 2023, 1st January.
But that was after realizing that there is nothing like that in the market.
Yeah.
So that is why you started. And I wanted people to actually know about Swasan. That Swasan was inspired by the lack of amenities in the society, right?
One thing is a lack of immunity. Second thing is a quick care and the patient having a one-step solution, right, to the one place. So any
all
kind
the
of
respiratory problems.
any kind of the respiratory problem, right, they have to just come to the my clinic, and by the end they can go out with his or her diagnosis, probable
without
diagnosis,
being admitted.
Without being admitted. Right. So when you admit in certain era, like in current era, the nobody have a much of the spare time, right? Even the families are getting nuclear in the small. If the people get admitted, his near one has to be take a leave from their job or maybe a break from their businesses, and they have to stay there. And then the process will start by their own step, on pose. Like sometimes you enter in the ERO to get in a room, the doctor will come, he order something, then that order followed by the staff.
There is no coordination, actually.
Yeah, there is a coordination, not lack of coordination, but that coordination in their way, in an indoor way.
Which takes a long time.
Long time. Where you come to the personalized center, right, who are made for just only for the respiratory medicine. So the staff are very much trained, right? The instrument where it comes to that, like when the patient has to come to the register, to their counter, they want to go to the my assistant, He find out what are the problem. He ordered the test. By the patient come to my cabin, he had already all the taste, and then we have to tell them this is a procedure. So next day, the room is the procedure room. We do all the procedure. Recovery room, patient recovery for half an hour, 1 hour, 2 hour, whatever the recovery time, and the patient go home. By going home, we can say them, this is a probably your diagnosis. This is my working diagnosis. Let confirm them by tomorrow pathologist confirm report.
This is generally when the patient comes to you as a pulmonologist. But most of the pulmonology cases are treated by general physicians, right? When do you feel a person from the public should come to you directly? I mean, what are the signs? Okay, this is not a case for a physician. This is a case for a pulmonologist. I think my listeners would want to know that.
Okay. So first and common most that is the patient having a long-standing asthma, which is not getting control.
The breathlessness,
Breathlessness,
basically.
yeah, asthma, breathlessness. So if the patient is breathless, is not definitely getting controlled by the routine medication which is given by their general practitioner or their family physician. Okay, then they have to step in. The people who smoke a lot, right?
Okay, smokers.
And their lungs get damaged because we had a specific machine which actually tell you how much the lung is functioning and how much the lung is able to transfer the oxygen from atmosphere
This
to
is
your lung.
available at Swasan?
Yes.
And it's not available elsewhere?
Very few corporate hospital have
Have
that,
it,
but
okay.
not in
Not all of them.
the personal doctor who own this.
What about chronic common colds?
Chronic complaints usually is a part of the chronic allergy, which is not
So
very
not
well
actually
controlled.
a pulmonology problem.
No, like it's a part of the ENT, part of the problem medicine, part of allergy specialist, right? But when it's come to the allergy part, usually upper airway allergies is the lower respiratory tract also like share the characteristic between the upper and lower. Okay, so when the people have a chronic asthma problem, allergy problem, they have asthma problem as well, but they are hidden because of the patient coughing and the
He thinks
sneezing
it's an
and all
allergy.
these things. Yeah.
So, but if it's chronic, then they have to think
Have
about
to
a
have.
checkup with you. How many?
Definitely.
Once in 3 months? Once in 4 months? So how would you rate it?
Usually when the asthma people or any people come to my clinic with COPD, I will try with all the probable medicine to bombard first, right? To get a maximum benefit. See, if the patient is coming with a 30% of the lung function, my target to reach is more than 80% because like it's not like 100% everybody reach, but up to 80 it is acceptable, right? So my target to reach 30% to 80% in initial days, right? So that get patient benefit a lot. Okay, so initially first follow-up is a 15 days, and after that if the patient has reached that benchmark, we reduce the medicine and call him by 45 days. If 45 days is okay, we further reduce the medicine, call him 3 months.
Okay.
If everything fine, again reduce the medicine.
So at Swasan, our center, which started in 2023, it has almost everything that you need.
Yeah,
you don't
definitely.
need to send the patient for investigations outside. Everything is done under one roof. So if they come to your place, by the end of the day, they have a clear diagnosis, maybe even the treatment.
Definitely,
and without
definitely.
being admitted. So Swasan has almost everything from beginning to end.
Yeah.
Right? So you don't need to send the patient outside. You don't even need to admit it, and maybe the patient will be cured and sent away. So I would say that it's a one-stop solution for anything related to
lung.
respiratory tract problems. Now, this is all about respiratory tract problems, you as a pulmonologist. What about Dr. Varun Patel, the person? So what is your hobby? What do you like doing? And which you feel that even patients around you should be doing so that, you stay healthy. Not just exercise, not just other things, but what else can be done by people?
Actually, my brought up everything is very small town. So I am more of related to the peoples and the nature. So when I brought up like in Ifo colony in Kandla, we have a one house and then we have a 10-15 minutes of difference and then another house. In between all the greeneries are there.
Okay.
And from childhood, like I do some of farming near to my house. And that I passionate too much more towards the nature. So I like sitting alone, surrounded
So
by
you
the
have
nature.
a garden at home?
Yeah, in Ahmedabad it's difficult to have a like big vacant plot and you create your garden. So what I did my father's friend's friend, they have their own farm, right? Is the land per se. So I keep it on a rent because
And
near
you do
to
farming over
Ahmedabad,
there?
I started farming there. It's about 28 vigha. So we had given now just put 28 vigha farm.
What do you grow there?
Right now, all kind of vegetables. We have wheat right now. We have
Green too. Okay.
green gram, and sweet corn right now. And we are planning to this time putting a banana on a larger
Just
scale.
farming or dairy farming as well?
Dairy farming, we had prepared everything, right? Just
But
cow.
not have started. Okay.
Just
But that is
cow.
the next project.
That's just cow.
So
We have to
that's
enter
quite
within cow.
fascinating. And you would suggest that this kind of fresh green air would be very healthy for the lungs.
After
I
my
think
SGP
one
round.
podcast with you is not enough, considering that this is such a viral field and everybody wants to know about it. So we're definitely going to invite you again. But thank you very much for being with us today. It was a wonderful exchange of information. And I'm sure most of our listeners now where to go in order to get their lung treatment done, and how, when they don't want to get admitted, when they don't want to hop from one diagnostic center to another one, but find everything under one roof at Swasan.
Yeah, so
And
it's
I
our
think this is in on I think just off Mithakali, right?
yeah, it's just on the SP Stadium.
Acha, near the stadium.
Near the
So
stadium.
that's where this is, and everything is possible there.
Everything
And if the
possible.
patient needs to be admitted, that too is possible there. So thank you very much, Dr. Varun, for
Thank
being
you.
with us today.
Thank you, Dr.
And we
Shachi.
enjoyed having you with us on VQ Podcasts.
Thank you.
Thank
Thank
you.
you, Dr. Shachi.
Yeah.
So,
Everyone who has been a victim during COVID knows what it is to have a doctor on their side when they have a lung problem. If you want to meet a pulmonologist of good renown with his own private hospital, then why don't you come to the next VQ podcast and meet Dr. Varun Patel? What if I were to tell you that any of your problems with the lungs can be diagnosed under one roof and treated in the same place without being hospitalized? You would be interested, right? Then do visit us with the VQ podcast.